Thank you so much, Kate. Hello, everyone. I'm Amruta Byatnal. I'm a senior editor here at Devex, and I'm really happy to have Atul Gawande as our next guest here. Atul comes to USAID as the Assistant Administrator of Global Health, and he comes into this role with a rich and varied experience. And I have to say, when I told my family back home that I'm going to be interviewing a published author, a Harvard professor, um, a founder of an innovation lab and a nonprofit, they said, yeah, but when are you going to be doing all of these things next? So thank you.
Like a good Indian parent.
Exactly. So thank you so much for raising the bar for all of us. But while I'm sorry to disappoint my folks, I'm really happy to be having this conversation here with you. Welcome.
Thank you.
So just to jump right in, you joined this role, you joined this organization at a very crucial time in equity for global health. So what are your priorities? What is your plan going forward? There are lots of challenges that have emerged in the last 2 years. So what is the plan to address these challenges?
Yeah, so first to explain to folks, I'm leading global health at USAID, U.S. Agency for International. In this role, I get to lead a team of 2,500 people who are organized in 63 country teams touching more than 100 countries around the world. It's been, USAID has existed since the 1960s and has been doing work in increasing equity in global health ever since John F. Kennedy created the program. And at the core of it is that drew me to it, which is work that I've been doing for the entirety of my public health portion of my career. I'm a surgeon as well. And that has been around the idea of health equity. And by health equity, we mean that what we have discovered during the last century is that, first of all, we've enumerated 70,000 different conditions that human beings can have, 70,000 different ways our lives can be harmed or brought to an end. Conditions, we've discovered 6,000 drugs, 4,000 procedures, and a couple thousand public health interventions. Trying to capability town by town, populations with the promise that it brings. That gives people access to that personal opportunity to count on an average for life expectancy with better health for a large. Now, even in my own country of the United States, we have not assured equity, but the job is to try to bring that goal, which every country strives for, the disparities within countries are even larger. And given a level of resource that we can do better and we can achieve remarkable results. And it's a matter of trying to build on those and extend them across other countries. There are many examples we can point to, but I'll just say 3 of my priorities are stemming from the fact that we are now in this pandemic in the first period in more than a century where there's been a global reduction in life expectancy. And understanding what the nature of that reduction in life expectancy is crucial. It has been because of COVID, but it's both the direct and the indirect effects. Direct effects have claimed 5 million, 6 million lives, but the total number of 15 to 18 excess deaths have been outnumbered by the number, especially in low-income countries, of maternal and child deaths, which have increased. So we talked about trying to have improvements getting to the SDG, the Sustainable Development Goals, but we have development going backwards with life expectancy, child mortality, maternal mortality going in the wrong direction these last couple of years. And that's getting even worse because of food insecurity now. We're in the middle of a global infant formula shortage, and malnutrition, I fear, will be worsened. So for these areas, I have 3 priorities: controlling COVID, being better prepared through pandemic prevention and readiness for response for the next pandemic and other health disasters. And third, really trying to strengthen our overall primary healthcare capabilities. We are going to require a systems approach to be successful. And I'm glad to see that that's been such a prominent theme here at the World Health Assembly this year.
Thank you for that. And, touching on primary health care, I think one thing related to that is community health workers and frontline health workers. So is that something that, you'd look forward to working on while you're at USAID?
Yeah, primary health care feels like an abstraction.
Mm-hmm.
What are you accomplishing when you're putting money into it? What does it mean we're doing? What you have to understand is it is fundamentally about health workers. President Biden, in his budget request to Congress for the next budget year, has requested $1 billion to be focused on health workers. That is the recognition that that by protecting health workers, ensuring that they're salaried, ensuring that they're trained, and ensuring that they're integrated into the health system and not volunteers in communities without any backup. That's when we get the dramatic effect on multiple things. Number one, we see a 50% to 2/3 reduction in child mortality when you have community-based health workers who are trained, salaried, supported to be able to touch all of the homes in a given area and connected into a primary healthcare system. That has been demonstrated in Ghana, been demonstrated in Ethiopia, and scaling those kinds of programs nationwide is a critical part of success in what we need to accomplish. The last thing I'd say about that is that the health workers are and that system is the base that allows for folks to, yes, target vertical programs addressing HIV, addressing maternal and child health needs like routine immunization, but then they're able to flex in crisis, whether it's about malnutrition that starts to appear, needs for vaccination, tuberculosis, and other areas, and that resilience comes from the workers themselves. We invest in them, the way we support them, and
Right, that's so important. And your crises are increasing. Unfortunately, you're also leading the work on Ukraine. So how does that sort of feature in your priorities, and what is the thing that we need right now?
So Ukraine is a great example of the need for how we respond in crisis and what the damage is to the way our own health systems function. In general, I would say we have an increasing number of health shocks, and that can be war, that can be climate related, it can be other kinds of conflict. And it can be outbreaks as well. And what we've saw in the 2014-2015 Ebola outbreak is that you can have, in that case, 10,000 deaths from Ebola, but it was far outstripped by the number of workers who then were not coming in and not being able to maintain systems for simple child delivery or routine immunization. All of those things fell through, and it was a multiple of 10,000 deaths of the 10,000 deaths for Ebola because the health system wasn't protected. And it's a different set of skills and a different set of capabilities. So in the Ukraine crisis, we decided in the Global Health Bureau, alongside our humanitarian assistance colleagues, to stand up a rapid response capability. That rapid response capability was about addressing the public health needs and the health system risks that were present from the Russian government's war on Ukraine. And in humanitarian assistance, that typically focuses on the immediate acute needs: food, shelter, acute medical care like for trauma. But when you look at what happened within the first weeks of the war, 90% of the pharmacies closed. All of the typical logistics operations that allow medicines to get distributed, all of the liability coverage for the companies that usually do that distribution disappeared. So they pulled out of the scene, and so now meds weren't being distributed. For example, there are 250,000 HIV patients across Ukraine. Their orders for their medications on which their lives depend stopped in February. Their lives depend on those medicines. Well, there are another 80,000 women who are expected to be delivering a baby during the middle of this war. We have much larger numbers of people with TB, in particular drug-resistant TB, whose needs were going to fall apart. And so although we've talked about hundreds, perhaps a couple thousand civilian deaths from direct attacks in the war or worse, it is many-fold that many who are at risk from the health system failures. So we at USAID fielded a small team to reprogram support that we've been providing there for years in the post-Soviet era, helping support them reduce corruption in their medicines supply chain, be able to have financing for healthcare workers and electronic medical records and supporting their policy, and shifted them to focusing on getting those supply chains back up and running and doing that in support of the Ministry of, and that Ministry of Health as a result, in part because of our help, we're able to get to 50% of the pharmacies open, and then now 80% of the pharmacies open with medical supplies moving through. But now with the supplies coming not just from private organizations, in fact, predominantly from 5,000 humanitarian aid organizations and getting distributed across the country. We've been able to support them with oxygen systems and planning for how to keep oxygen flowing to the hospitals. We've supported them around how to train workers for treating and dealing with potential chemical weapons attacks, and keeping the hospitals protected from a chemical weapon contamination so that the hospitals themselves can function. We've seen escalating cyber attacks trying to pull down the electronic health system, the health information systems that keep the hospitals functioning. And we've been able to successfully partner to give the technical assistance to get those electronic systems into the cloud and hardened against those to take the system down. I'm increasingly convinced this is a different kind of skill set from what ordinary humanitarian assistance is required. And in other disasters, we see a slow motion collapse in Burma of the healthcare system. We see other areas of the world where you can build on the support of you're only as good as your existing health system and your health workers, but enabling them and having teams who understand what their needs are and helping a government or local NGOs maintain resilience of the health system in the face of these attacks, I think is critical. Absolutely will be a significant part of what we want to enable to happen during outbreaks, so that you're not sacrificing the care of mothers and newborn children for the sake of the acute health risks that are mounting.
Right, exactly. And you mentioned, partnering with local governments, and localization has been a key theme for Administrator Samantha Power. And here at Devex, we've been writing a lot about, the movement to decolonize global health. And the way I see it is that decolonizing is the goal, but localization is the way to get it. But how does that really play out on the ground, especially in global health?
Yes, so Administrator Power, who's my boss, who leads global health, has made a commitment that we will aim to achieve 25% of our funding outlays going to locally led organizations. That means local civil society organizations and other organizations in the countries, and that 50% would involve direct local voice as well. And this is critical because that is how you build capacity and build leadership. There is now solid evidence that we usually rely on these large multinationals that to provide aid through, because they have a proven track record, and it's an easier channel to work through to get things started. It takes more upfront work. On the other hand, when you've built the capacity with local organizations, we're seeing that there's not a diminution in the output and the success. It does take more work up front, and we have to invest in and make the systems easier to make that possible. But we've seen that's possible. We can get to that point. We can go even farther. PEPFAR as a program has committed to 70% of their work going through local organizations, and our teams have gotten to 62% thus far. They've shown us already what is possible. Thank you for that show of hands. I think this is incredibly important. This is what inclusive development really means. It's not just that we are partnered with countries on their priorities that we're supporting, but that we're also helping build local organizations, even if sometimes they're not always the ones that the government necessarily chooses to back. It's important to build that civil society strong, independent capability as well.
That really
Oh, can I give a
resonated.
great example?
Please do.
So Ukraine is one example. One of the a middle income country that we've been involved in for many years, which is less the norm, but it showed the same way that we have had a number of locally committed organizations, from 100% Life, which is our civil society partner for our HIV/AIDS program, to all of that work I described about bringing corruption out of the system of medical supply chains. And the leader of that work then was brought in by President Zelensky to be now the Minister of Health. And that is an indication of what is possible, that by developing local capability, we find that our partner and guide to what we should be doing in country for President Zelensky on health is precisely the person that we've known all along as a partner of ours. And that's what we want to see all the world over.
Thank you so much for that candid answer. One of the challenges that you face right now is convincing the US Congress to keep continuing COVID-19 funding. How do you deal with that? As a seasoned communicator yourself, I'm sure it takes some narrative building, it takes some storytelling to actually show what is needed on the ground. How you
clearly not being effective enough as a storyteller. Look, the world, as we have been through a decline now in Omicron, constantly says, "Oh, now it's over," and so we're tired of even here, right? I see about 10% of you, 20% of you with your masks on, and the rest not, and we're COVID levels are as high as they've ever been. Now we've found ways. We have tools with vaccine. All of you have been using tests, which has been amazing, and we're going to work to keep WHO from being a super spreader event. So we have the tools of rapid tests, vaccines, and increasingly the oral antiviral pills, which can cut the deaths by up to almost 90% if you get it within 5 days of symptoms starting. And so those capabilities have started to allow us to disconnect the cases from the deaths. And in high-income parts of the world, that has become our reality. We're able to gather like this, and that's a miracle. But we can easily forget low-income world does not have access to these rapid diagnostic tests. There's barely half a dozen manufacturers that have been approved by WHO at this point, and the production and orders are not there, as the markets are not there, and the commitments for buying have not allowed those production lines to be open. And so PPE production, rapid test production, all have dropped through the floor. And when we come to the next surge, we're not ready. Add to it that we don't even have oral antivirals available at all widely. We have just come through the president's summit, second presidential summit on COVID, in which we reiterated, number one, we need Congress to continue funding, to not cut off the funding for COVID-19 on the US side. We have committed $19 billion, including buying enough vaccines for having enough vaccine supply for 1 billion people in the world to access vaccination. We have reached a point where we now have enough production to have vaccines, but now we have to keep the funding running in order to get the vaccines into arms, to make sure that rapid tests are widely available, that the production lines remain, and that the supply of oral antivirals does not replicate what happened with vaccines, with the rich part of the world absorbing all the supply and none being provided for until later for the lower income parts of the world. So, we want desperately to believe it's over. We have to be prepared for a wide range of outcomes in which we still may have the worst ahead of us. Yes. And finally, we need to have Congress bring in this money.
Do you have a plan B? What if it doesn't work?
Well, part of Plan B was in the presidential summit. We asked for whether countries would come to the table, even though we had not brought, like we have before, billions of dollars in commitment. And the world came forward with $3 billion, $2 billion for acute needs, and almost $1 billion towards pandemic preparedness. That, I think, is a sign of what's to come. We have a Gavi, a Global Fund replenishment this year, Gavi replenishment. We have polio still ahead of us. And so the world is being called to act. We have shown we will do our part in the US, and we're grateful that the world has given us credit for that, and coming forward. But we want to continue to show our own leadership, and we will be calling upon the rest of the world to help as well. And we will get Congress to get there.
Good luck with that, and thank you so much. We will be watching here at Devex. And thank you so much for your time.
Thank you.
Thanks, everyone.